You still have to have a protocol with a physician. With the protocol, we can, under his name, administer those vaccines to the patients. Now, once we do that, we'll give them a card saying, this vaccine has been administered on this date, so they can carry it with them. So it's not without really a doctor's prescription. It's sort of a blanket doctor's prescription that you have when you have a protocol, because you still have to have the physician available in case of an emergency. Thank you. Fortunately, we've never had one, knock on wood. Physicians, if they want to administer those vaccines, they can do it at the annual visit as well, so they have that opportunity to do that as well. Up to this point, most of them have been writing a prescription for different vaccines that you don't have time to either administer or don't stock in the office. But for example, the shingles vaccine has to be kept frozen. It has to be administered within 30 minutes after it comes out of the freezer. And these things cost $200 to $300, over $200. Let's say, for example, the doctor was fixing to administer a vaccine, emergency came up. If something came out that he would not be able to administer, he'd be out that amount of money. The benefit is that more people will be able to get vaccinated. We hope that has happened with the flu vaccine when patients were able to started getting it in a pharmacy. The number of people who were vaccinated went up considerably. We do encourage people to get their flu vaccine. So does the Center for the CDC, the Center for Disease Control. Also, they recommend flu vaccines and pneumonia vaccines and shingles vaccines as well. The convenience of getting at a pharmacy without really usually having to make an appointment and not a long wait is very convenient for the patients. Hopefully in the future there'll be some other vaccines available that we can give patients.